Esophageal cancer has increased almost 600% in the last decade. Dr. Ramy Awad shares how sometimes surgery can reduce taking medications and how obesity and acid reflux can go hand in hand.
Dr. Awad, I had a very close friend that died of esophageal cancer. And not to be negative, because I'm really not negative, but so many people, including myself, are on acid reflux medication. What would you suggest if somebody is on medication all the time for years and they keep dealing with this? By the time my friend, Steve DeCure, went into the doctor, he was in stage 4 cancer. So when do we know what to do to change this?
That's a good question, because the rate of esophageal cancer has increased dramatically, almost 600% in the last, decade and a half, and it really parallels one thing, the obesity epidemic. We know obesity correlates to acid reflux, but reflux really is kind of related to a pressure phenomenon or a valve problem. So if you have a lot of pressure in your stomach or you have a weak valve, the acid in your stomach is going to reflux up into the esophagus. So medications really address the acid component, but not the anatomic component of a incompetent valve, a weak valve that allows you to reflux. So what patients should know is that there is different options for reflux, and it's not something patients should always suffer with, because there's risks, not only risk of esophageal cancer, but risk of certain things like dietary modifications and limitations. Certain patients can't enjoy a spicy bowl of pasta or a glass of wine. So there's a lot of dietary modifications that they have to experience. Also lifestyle modifications. Some patients, their reflux is so bad that they can't sleep flat. So it's becoming a very common problem. We're seeing a lot of patients with reflux, and the main thing is, there's a spectrum of treatment. First thing you want to really kind of rule out, if they had long-term exposure of the esophagus with acid, surveillance of the esophagus. So esophagoscopy, some sort of endoscopy where you survey the esophagus, make sure it looks okay, biopsy, make sure there's no precancerous changes, and based on that we make a lot of recommendations. It really starts with lifestyle modification. Sometimes patients identify food triggers and say, this makes my reflux worse, I'm going to avoid this. Certain things like tight-fitting clothes make it worse. Sleeping flat right after a meal can make it worse. You're taking away the effects of gravity. And then if lifestyle modification doesn't really address it, then we move to pharmacotherapy, drug therapy. And the proton pump inhibitors now are very effective in reducing the acid. It doesn't eliminate the acid exposure, but it reduces it. So basically it just turns down the burn, essentially, almost like turning...
But how does it affect the rest of the body, and is this something that would be healthy to live on the rest of your life? Or wouldn't it be better to fix the problem, especially if it's already turned into GERD or something a little more advanced than just acid reflux? Wouldn't it be, the conservative thing would be to fix it with a surgery?
Well, some patients, are fearful of surgery, and not everybody's a candidate for surgery. If dietary modifications and lifestyle modifications really kind of work to address a problem, and patients have a couple episodes of breakthrough that they have to take medication for, we advocate that. In terms of the risk of these proton pump inhibitors and these medications, there is some implication in things like osteoporosis, drug-drug interactions. Certain blood thinners don't work well with it. Also, it changes your intestinal bacterial flora.
Interesting.
So there are risks. They're pretty safe medications, but there's patients who say, if you can fix this with a surgery and I can eat what I want, why not?
And go off of medication. I think that sounds healthier.
So then we address surgery in patients who, one, are refractory to lifestyle and dietary modification, as well as drug therapy. They're taking medication and they still get breakthrough episodes of it, and they're experiencing lifestyle limiting reflux. If they have so many dietary modifications that they say, I can't enjoy eating anything or enjoying a glass of wine, or they're concerned about interactions with medications. So these surgeries are safe, and there's a lot of times reflux is associated with a hernia through the diaphragm called the hiatal hernia, as well as a valve that's weak. So surgery, unlike medication, addresses the anatomic issue and corrects the anatomic issue, as opposed to just take care of the symptoms.
It's a Band-Aid to just take a medication.
Well, it just reduces the acid,
Exactly.
content and exposure.
But it has other risks. If you're not getting it interacts with other drugs differently. It changes the flora in your system. Those are serious things, I think. I mean, am I wrong on that?
They are, these are possible effects of the medication, and patients are concerned. And I think patients need to know that there are surgical options.
There are options
that are very effective and safe for these.
And are they as safe as the gallbladder surgery?
It depends. You have to really
like
have
a
to,
hiatal hernia surgery.
It depends. You really have
Okay.
to have a surgeon who's experienced in the
Okay.
foregut or the upper abdomen. Someone who does a lot of these.
Well,
These
how
are
about
really
you?
kinda-
How
we do a lot of these.
experienced are you in that?
That's where we live. We do a
Okay.
lot of bariatric surgery, and we work on the stomach and the esophagus quite a bit. So that's an area of.
So you would be an expert in hiatal hernias.
We do quite a bit.
Okay,
And
that's
there's
excellent.
There's a lot of those we do in association with bariatric surgery.
Okay.
A lot of my bariatric patients who come in for a gastric bypass or a sleeve do have hiatal hernias, and we fix it at the time of surgery as well.
Interesting. That's good to know.
But the anti-reflux surgeries usually are in combination with a hiatal hernia repair, and it's a procedure where you take the stomach, you fix the hernia, you mobilize the esophagus, and you essentially wrap the stomach partially or fully around the esophagus, and that really restores the pressure of the lower esophageal sphincter, that valve, so you almost are putting a belt around the esophagus, so it's less likely to have acid come up.
And is that good for the rest of your life? How long does that surgery last?
They tend to work pretty good.
Okay.
They tend to work pretty good. They're
And
very
how long
effective.
before they can start eating regular food?
They are put on a stage diet.
Okay.
So obviously there's going to be some swelling related to the surgery. So
Okay.
for about 2 weeks we put them on a clear liquid, full liquid, and then they advance themselves to a pureed consistency, then soft food.
Okay.
But we really advocate starting early to eat because it's almost like physical therapy for
Right.
the esophagus. And within 2 to 3 weeks they're really eating regular foods.
So you coach a healthy lifestyle. with
It's
this,
important, absolutely.
With any surgery on how they eat and when they eat. Okay.
Absolutely, and that's important for any surgery we do, and also for bariatric patients. It's very important that they implement health into the lifestyle.
Great. Okay.